Hello, everyone. Welcome back to the H.V.M.N. podcast, and I'm your host, Dr. Latt Mansor, a PhD in Physiology, Anatomy, and Genetics, and the research lead of H.V.M.N. and Nutrition. And if you enjoyed this episode, go ahead and leave a review. And if you have any question, leave us a comment. And as always, we appreciate it if you can share it with a friend. Now, without further ado, let's get into this episode of H.V.M.N. podcast. Hi, this is Dr. Latt Mansor, your host on H.V.M.N. and Nutrition podcast. In this episode, we have Dr. Terry Wahls, who is an Institute for Functional Medicine certified practitioner and a clinical professor of medicine at the University of Iowa, where she conducts clinical trials in the setting of multiple sclerosis, or MS. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. In this episode, she shared her touching story of recovering from the debilitating effects of MS herself and move on to treating other MS patients with her own experience and knowledge. We also talked about the potential causes of MS as well as the multimodal approach that Dr. Wahls uses to treat the disease. So please enjoy this episode and stay tuned. Hello, today we have Dr. Terry Wahls. Thank you very much for coming on to H.V.M.N. and Nutrition podcast.
Hey, thank you for having me.
Yeah, so we are recording here on January 4th, 2023. Happy New Year. And before we go straight into the content here, it's going to be a very science-packed content. I would like our listeners to hear a bit about you, like who are you, what's your story, before we go straight into Dr. Terry Wahls, who is the world expert in multiple sclerosis.
So, I have a very personal connection to this illness, and I'll tell it in real time as it happened. So about 20 years ago, out walking with my wife, Jackie, a half mile from home, my left leg grows weak. Dragging it, I hobble home. The next day, I see the neurologist who says, Terry, this could be bad or really, really bad. And so for the next 3 weeks, I go through multiple studies, and I'm thinking about bad and really, really bad. And I don't want to become disabled. I don't want to become a dependent. And so actually, I'm praying for a rapidly fatal diagnosis. But the problem is, I also think about the 20 years of worsening electrical face pains that I've had. And so I know that I probably do have a progressive illness, and that will probably ultimately be disabling. 3 weeks later, I hear the words multiple sclerosis. I do my research. I find the best MS center in the country. I see their best physician. I take the newest drugs. 3 years later, I hear tilt, recline, wheelchair. My face pains are relentlessly worse. My 10-year-old daughter hugs me as tears stream down my face. And that's when I go back to reading the basic science. And I've already adopted the paleo diet. As I read these scientific papers, I decide that mitochondrial dysfunction is what drives disability with MS. And I gradually devise a supplement program to support my mitochondria. And that slows my decline, and I'm very, very grateful. But I am still declining. In the summer of 2007, I am so weak I cannot sit up in a regular chair as I am now. I have a zero gravity chair with I sit in that as I staff residents in their clinic with my knees higher than my nose. I'm beginning to have brain fog. My chief of staff calls me and says, Terry, I'm going to assign you to the traumatic brain injury clinic, and you'll see patients without residence. He describes the job, and it's more physically demanding than what I can do. I'm really quite bummed by that. I'm going to have to finally apply for medical disability. In the following week, I review a study that uses electrical stimulation of muscles in spinal cord injury. And ask my physical therapist, can I try that? He calls it E-stim. He says it's for athletes. Yes, he could build bigger muscles for me, but he doesn't know that my brain could talk to those bigger muscles, and he might just be making it harder for me to walk. But he gives me a test session. It hurts bad, really, really bad. But when it's over, I feel great. He says it's from the endorphins, and we add electrical stimulation of muscles to my physical therapy. And a couple of weeks after that, I discovered the Institute for Functional Medicine. I take, and they have a course on neuroprotection, and I sign up and I take that, and I have a longer list of supplements that I'm now that support my mitochondria. And I'm so excited to be reading about mitochondria. And then, so I'm doing eStim, I'm taking all these supplements, not a lot's happening. And then I had this really big aha moment, and now I'm sort of embarrassed about how long it took me to have this aha. It's like, what if I redesign my paleo diet that I've been doing already for 4 years, uh, and I focus on where these nutrients are that I'm taking in supplement form, where they are in the food supply. So that's a few more months of research. And I start this new way of eating in 2007, December 26th, to be precisely.
That's my mom's birthday.
Oh, it's a very auspicious day. So, January comes in, I go to the traumatic brain injury clinic the first 2 weeks. I'm in my tilt recline wheelchair. I'm watching my partners do the exams. The third week, so now it's the fourth week of this new way of eating. Now I'm supposed to start doing these exams. And then the first day, I come home and I'm like, well, that wasn't too bad. And then at the end of the week, I tell Jackie, this wasn't too bad. Maybe I can do this. And then February comes along and I realize I'm more mentally clear. And I tell Jackie, I want to switch out the chair. I want to sit in a regular chair at the supper table. And so I'm sitting up in a regular chair to eat my meal with my family for the first time in years. Big deal. And then at the end of February, I start walking with walking sticks at the hospital at the VA, and people are stunned. They're like, "Oh my God, Dr. Wahls, you're walking." And then, yeah, in April, I'm now walking around the hospital without walking sticks, and I tell Jackie, do you think I could try riding my bike? And she says, well, maybe if things keep going well, maybe in the fall. Well, 2 weeks later, it's Mother's Day, and I want to ride my bike. So we have an emergency family meeting. Jackie tells my big 6'5", 16-year-old boy, he's going to run on the left. She'll tell my 13-year-old daughter she's going to run on the right, and Jackie will follow. I get on my bike, and I bike around the block. That big 16-year-old boy, he's crying. My daughter's crying. Jackie's crying. I'm crying. And I still cry now talking about that, because it was at that moment that I understood that the current understanding of secondary progressive multiple sclerosis is incomplete. And who knew how much recovery might be possible? And so after that, I'm riding my bike a little bit further every day. And in October, Jackie says, let's sign you up for the Courage Ride. It's 18.5 miles. And so once again, when I cross that finish line, everyone's crying. My kids are crying, Jackie's crying, I'm crying. And this fundamentally changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of the research that I do. And that was for almost 15 years ago. And I started talking to the public, and man, I was really condemned. I was
I can
condemned
imagine.
as dangerous. The neurology community said clearly I could not have had a multiple sclerosis because I could not have recovered. And it was very intense. There was a lot of hate sent my way because what I was doing was so radical and completely unheard of.
I mean, I met you in sort of end of October. at the
Yes.
Halloween event, I wouldn't have thought, like, if we didn't talk, I was like, she's a perfectly healthy human being, and we sat down and we talked, and here we are. We're
And here
talking
we
about
are.
our podcast. Yeah, I can't believe you're doing this to me, Terry. You're making me teary on my own podcast.
Yeah.
It
It's
was
quite
an
a
amazing
journey.
story. It's quite an amazing story. And what have you been doing since then? Clearly you've had a lot of opposition from the medical community, as one
Yeah.
would, because they're very dogmatic. We know the medical and the scientific community is very much like, my PhD supervisor used to tell me, like, if it's not broken, do not fix it, do not change it. Like, it's that kind of mentality. Um,
I'm actually, um, I think we all are like this, however. How I understand the world, how you understand the world, um, what lets us operate, the vast majority of information coming to my nervous system is ignored. And I know how to operate using just a fraction of the sensory input that I get. And that lets me work very effectively. What that means is my understanding of how science works, of how gravity works, of how I get to work every day is based on pattern recognition. And so when there's new information that comes through that doesn't fit the pattern as I understand it, I'll ignore it for a
mhm.
long time until there's an overwhelming amount of evidence. And so, I tell my PhD students and my med students that if you have a really new idea and you do a new experiment and you get really interesting results based on this really new idea, you will have an enormously difficult time getting that first paper published because it is such a new explanation of the world. You won't be able to get into the New England Journal of Medicine or into Nature. You won't get into a high impact journal. You won't get into a moderate impact journal. You'll have to go find a really, really low impact journal that is willing to entertain this peculiar idea. And then you'll do another experiment and you'll write up your manuscript. It'll be a little bit easier to get published, and a little
Mhm.
bit easier, and a little bit easier.
And you can cross-reference.
And you cite your previous work, and other people begin citing your work, and other people begin citing your work, and gradually your ideas seem like, well, it's an interesting idea. And then gradually it seems like, well, this is really a good idea. And then eventually it's like, oh my God, it's obvious. So we've done 7 clinical trials. We're in our 8th clinical trial now. Consistently, I'm able to show that the concepts that I've been talking about for about 15 years, diet, stress reduction, exercise, all have a favorable impact on your quality of life, on your comorbid diagnoses, your mood, your motor functions, your thinking functions. And of course, the more helpful things that we do in our health behaviors, the larger the impact will be.
Mhm.
It was so radical in 2010 when I did that first study. People hated the fact that I was combining everything, that I did diet, targeted supplements, exercise, electrical stimulation, and meditation,
Multimodal, yeah.
multimodal. They just hated that because the response was, if it works, we won't know why.
Which, yeah.
And the reason I was able to have that happen was that my chair of medicine, who had watched me go from being athletic to being profoundly disabled, to come back walking in his office, and he was a rheumatologist. And he had said, Terry, this is really remarkable. He wanted me to get a case report written up, which I did. And then after I wrote up the case report, he wanted me to do a safety and feasibility study. And so I started writing up that protocol. And fortunately for me, he went from being chair of medicine to the dean of the College of Medicine. Because when I wrote up my protocol, the Institutional Review Board disapproved the study. Because they said, you're the only one this is ever, there's no safety data on it, only you. And we don't know
Correct.
that it's safe for anyone else to do this. And Paul Rothman, bless him, he said he wanted that study to happen. So he called the chair of the IRB and
Mm.
said, you work with Wahls to find out what she needs to do to address the safety concerns. And the question is not about what the mechanism is. The question is, will people do it? That's the only question that she has to ask is, will people do it? And then the next question is, does she hurt anyone in the process? And then the third question is, what is the effect size of the various things that she's doing on quality of life? So we did ultimately get approved. Then I'd have to raise $100,000 so I could do all the testing that was required. And we have to thank the folks in Canada in the maker of the electrical therapy device that I used to getting me the funds so I could do that study.
Amazing. Now, that's the pros and cons of science, right? Because in science, we always try to minimize the variable so that we can pinpoint what exactly is causing the change. But human bodies, as we know, it's more complicated than that. We work on multiple level, multifaceted, and as a complicated chronic disease such as MS, it's important for us to acknowledge the different aspects of life that may contribute to either the worsening or the improvement of the disease.
Well, it will work. Control all the variables is beautiful for a a drug study,
Hmm.
very effective. But if you want to improve health, and then we can sort of think about how many chemical reactions happen in my cells every second. 1, 2 million, maybe?
Yeah, exactly.
That's really very, very complicated. And it's very messy science. Um, it's difficult science. It's difficult doing these complicated multimodal studies. And when I write my grants to the NIH, I get scathing reviews. They don't like this complicated multimodal stuff. They want me to
Right.
do a single molecular one variable pathway. Um, However, I am so blessed because I also take care of patients. And we've had extraordinary success with changing the lives of the people that I take care of. And some of those folks then come to me and say, I believe in what you're doing, Dr. Wahls. I'd like to help you do your research. And so I've I've had most of my clinical trials funded by private philanthropy, which lets me do these interesting dietary studies or these complicated multimodal studies.
Yeah. So before we go further into the intervention, let's, for the sake of our listeners, let's go back to the disease itself, multiple sclerosis. Medical school 101. Just explain to us what exactly is multiple sclerosis. How does the disease development happen, and what actually causes it?
So we have the brain and the spinal cord and the cranial nerves. That makes up the central nervous system, and that governs thinking, a lot of mood. It governs sensation, motor control, and we began first describing multiple sclerosis, I believe in the 1800s. There were these white scars that could occur in the brain and in the spinal cord, and was involved in developing problems with sensation and problems with motor movement and control. We would eventually realize that it was a immune attack, that is your immune cells, white blood cells, are attacking parts of your brain and your spinal cord or your cranial nerves. And that it's attacking the myelin, which is the insulation or the coating on the nerves that let the nerves conduct information really very quickly. There are genetics that make you perhaps a little bit more vulnerable. We have maybe 200 to 300 different genes that increase the risk, just a tiny little bit for each individual gene. There are a handful of genes that increase the risk more substantially, perhaps 10 to 15%. So that's step one. You have to have the wrong genes. Step two is an infection of some type that occurred sometime earlier, probably as an adolescent, perhaps as a preschooler, that you don't properly clear. And then step three is we don't really understand. There's this complicated interaction with, quote, unknown environmental factors. If you're overweight, if you smoke, um, that certainly increases your risk. But then there are other environmental factors, probably what you're eating, your physical activity, your toxin exposures, your adverse childhood events. And that's why people will say, we don't really know what causes MS. It's a complicated thing. Some genetic component, some infectious component, and these environmental components. My brilliance is like, okay, so we don't know. But we could address all the environmental components and shift all of those environmental factors towards the most health promoting context that I could create. So fix your diet, add a stress reducing practice, increase your movement, physical activity, talk about your adverse childhood experiences, get talk therapy if need be. Reduce your toxic exposures, so get rid of tobacco. Um, uh, Improve the quality of the air, the water. If you're in a toxic, very toxic environment, you may need special filtration for your water or special filtration for the air that you're breathing. And what this is what I find in my clinical practice is that I tell folks, yes, see your specialist, let them treat your chronic disease. And people usually have multiple chronic disease states. They have often multiple autoimmune problems. Let your specialist treat those for you. Work with me, and I'm going to help you tune up your health behaviors. And we're going to work on increasing the health of your cells, the health of your microenvironment. And then I'll watch you for your medication use so you're not over medicated. Because if your cells start doing the chemistry of life more correctly, you will no longer need as many prescription medications to control your blood pressure or your blood sugar or your mood or pain for that matter.
Right. And I know in September 2022, you published a paper on Wahls behavior change model. Is this what the Wahls behavior change model about?
Yeah, so the Wahls behavior change, I think we have about 15 steps that I'll teach my clinicians to use to take people from their current everyday life to grow their understanding that change is possible. So that's inspiration. And then we begin step by step helping them grow their motivation to gradually create a more healthful environment. Because the usual behavior change model is you're pre contemplating, then you're contemplating change, then you begin to prepare for change, then you make your change, then you fall off the wagon and you relapse and you have to start all over again. I think it's much more nuanced in how we help people be much more successful. So we've created a much more detailed step-by-step process.
And I know earlier on you mentioned in the earlier days you thought it was the mitochondrial health and mitochondrial sort of deficiency that's causing. Is that still the case from your years of research and intervention?
Yeah. So the worsening, where you have acute flares of symptoms. Oh, there's a lot more. If I did an MRI, you'd see enhancing lesions, and there's a lot more immune cell activity. That's an inflammatory component. And we have drugs that are really great at turning off and blocking that inflammation. And so you don't have as many relapses. And you lengthen the time that it takes to become wheelchair dependent, to losing your job, to having cognitive decline. So instead of having it be 10 years, it's now 15 years. So definitely progress. There's more awareness that inflammation is part of the problem.
Mm-hmm.
Neurodegeneration and shrinkage of the brain, shrinkage of the spinal cord is what drives disability. And I think that is a mitochondrial problem. If your mitochondria can't generate enough energy, they can't nourish the myelin, they can't nourish that coating, they can't nourish the axons, they can't nourish the synapses, they can't nourish the oligodendrocytes that are repairing the myelin. So I think mitochondria is still a very, very big part of the illness.
And I know that, fatigue is also a big part of MS. So obviously, mitochondria and energy generation, that also plays a big role, I would assume, in maintaining sort of energy levels so that they don't go into fatigue stage often.
Yeah, if you have excess inappropriate inflammation, that will lead to more fatigue. So more inflammation will lead to fatigue. If your mitochondria can't generate enough energy, that will lead to more fatigue as well.
Right. And I know you published another paper as well, looking specifically at fatigue. Could you tell us a little bit more on how you counter fatigue in your clinic and in terms of intervention?
So for MS, this is probably true for really anyone with a systemic autoimmune problem. Fatigue is the most disabling symptom, and it's the number one reason that people leave the workforce. You can get scooters and wheelchairs to deal with mobility impairment, but exhaustion is common. People can have profound exhaustion early in the morning, that they sleep at night, but they don't wake up refreshed. And there's been a lot of discussion. What is driving this fatigue? We don't have a particular biomarker that will strongly correlate with the severity of fatigue. We don't have a particular MRI signal that correlates strongly with the severity of fatigue. We do know that if inflammation is high, people will have fatigue, but you can have profound fatigue even in the absence of inflammation. I think it's multimodal. I think inflammation is part of it, and I think mitochondrial dysfunction is another part of it as well.
And how did you measure fatigue in this sense? Is it a subjective sort of measurement, or is it more of a biomarker?
So in our studies, this was a perceived fatigue. So we used a fatigue severity scale score. So that's 9 questions that people ask about how severe the fatigue is impacting various aspects of their life. Then we also have a more detailed questionnaire that has 42 questions in it, the modified fatigue impact scale, and that is just a much more sensitive measure of fatigue. It measures physical fatigue. It also measures cognitive fatigue and emotional fatigue.
I would like to take this opportunity to acknowledge our sponsors of this show, Ketone-IQ, the best exogenous ketone you can take to elevate your blood ketone levels. I personally take it every day before a podcast to wire my brain up, before and after my workout to really feel my body. So give yourself a chance, take a shot, and you will feel the difference within minutes. So head over to hvmn.com and use the code HVMNPOD20, that is HVMNPOD20 for 20% off your purchase, and enjoy your Ketone-IQ and give your brain the perfect fuel. the next part of this session is what I'm very excited about, and I know what you are very excited about, which is the current study that you're
Oh
now
yeah.
actively recruiting. And guys, for listeners, I will put the link to the screening in the description in the show notes and the YouTube as well. And walk us through what this trial entails. Like, who is this for? The inclusion criteria. What will they expect from this trial, and who should be signing up for it?
So we want people with relapsing remitting multiple sclerosis, age 18 to age 70. You need to be able to walk 25 feet, and that you have to be willing to come to Iowa City, Iowa. So it's the middle of the country at month 0, month 3, and month 24. And you have to be willing to be randomized to any of the 3 diets. One diet is the modified paleo diet, which basically is the diet that I use for my own recovery. Diet 2 is the time restricted olive oil ketogenic diet. So it's a lower carb diet. We use olive oil for the fat, so it's very heart friendly, heart healthy. And we have people eat within a 6 to 8 hour eating window. And then the third diet is your usual diet, and we give people some tips every month on how to reduce their processed foods and basically eat a healthier diet. Our main primary outcome is improvement in quality of life, but we're also looking at walking function, hand function, vision function, and working memory. And we are looking at brain volume. Because we have a research MRI, so we'll get a brain volume study, and we'll be able to see are there any enhancing lesions at time 0 and at the 24-month mark. Because you see, people with multiple sclerosis, our brains are shrinking 3 times as fast as happens when you have healthy aging. And that's why cognitive decline is such a big problem for people with MS. One of my hypotheses is that if we help people improve their diet, we can get their rate of brain volume shrinkage back to healthy aging. And I am very hopeful that both the ketogenic diet and the paleo diet will get to healthy aging. And I think it's also quite possible that the usual diet will get to healthy aging. And Latt, the reason I'm hopeful about that is that I know people who sign up for dietary research studies want to improve their diets. That's
Mhm.
why they agreed to be in the study. And that always the control arm improves their diet through eating a diet that's much better than the standard American diet. And we're going to give them tips every month on things they could do to improve their diet. So it's quite possible that all 3 arms will have significant improvement in quality of life, and that all 3 will have significant improvement in the rate of brain volume loss. And I think that will be probably the most interesting papers that will come out of our out of our study. Will be a look at what happens. Are we able to get people to healthy aging? Because right now, none of the drugs can do that. We have drugs that are really great at stopping the relapses, that are great at stopping the number of enhancing lesions, but they do not prevent the rapid loss of brain volume. I am very hopeful that what we're doing will do that.
That's yeah, that's interesting. And you mentioned the 3 arms of different diets. Like, one is modified paleo diet, which makes sense because you've used that, and then you've got the normal diet, which you send tips, and then in the middle you have sort of the ketogenic diet, but sort of coupled with intermittent fasting as well. So how does that came to into the picture?
So the ketogenic, there's some very interesting pilot studies that a lower carb diet, ketogenic, high in fats, uh, has been associated with better anxiety scores, so less anxiety, less depression, and marked reduction in fatigue severity. Now, no, And they had a 6-month look at MRIs. And in that study, there were no adverse events, no increase in lesions, but it's such a short window of time, they couldn't really make any statements about brain volume loss. So you have to follow people for 2 years to be able to look at that. I think from a mechanistic standpoint, if we presume that mitochondrial dysfunction is the big driver of disability and of brain volume loss, then putting people into ketosis, we would predict will generate more ATP, more efficient use of energy generation for those mitochondria, and would have a superior outcome. Now, long term, is a modified paleo diet easier to follow than a ketogenic diet? Perhaps we're going to find that out because we're going to be trying to get people to follow both the paleo diet and the ketogenic diet for 2 years, and I'm certainly very hopeful that people will do well. I certainly see that with any dietary study, if people experience a symptom reduction as they adopt the intervention, then it's easier to adopt the intervention, easier to sustain it. And if when you abandon your diet and go back to your previous diet, symptoms come back, then you got some feedback going and like, you know what? I do feel better on this new way of eating, so I'm going to stay on it. And that's part of what I teach patients is we want them to pay attention to as they implement whatever dietary change that they're assigned to pay attention to their symptoms. What food choices lead to fewer symptoms? What food choices lead to worse symptoms? Because we have to be able to moderate our own behavior. And that gets me back to the Wahls behavior change model is people have to moderate their own behavior. And it means I have to be the one to be able to see like, yep, this is worth the effort because it's more work to eat this way. But I feel better. So yeah, it's worth the effort, so I'm going to do it. If I don't feel better and all that delicious food that is everywhere around, all my friends are eating it, they're trying to say, "Oh, Terry, come on, this cheese pizza and beer, it's really it's so good. One piece isn't going to get into trouble." And you'll regress back to your previous diet unless we've taught you to pay attention to. I really do feel better when I'm eating the study diet. And I do feel a whole lot worse when I go back to that previous diet. If I can get people to make that connection, then I think we'll be very successful at keeping them on the study diet. And the reality is, if they don't feel better, they're not going to stay on the study diet. They'll regress back to their previous diet.
Right. And this is a 2-year study, right? You said, and during that time is the dietary modification the only intervention that you're implementing, or also the other parts of lifestyle?
So for this study, it's a dietary intervention study.
Okay.
This is only diet. Now, I do have other studies that are multimodal, and so we just did a study that was an evaluation of an online course that combined diet, stress reduction, exercise, physical therapy, and so that was definitely a multimodal course.
Now, if they sign up for this trial, can they also have access to come to you as a patient to improve their condition?
So
Because that would definitely affect the result of or the outcome, right?
So if they're in the trial, we are asking them not to add any new exercise programs unless prescribed by their physician. We've not created a protocol that prohibits people from coming to see me as well. So if they did come to see me as well, I would not be changing the diet to which they'd been assigned.
Fair enough. Um, that's so, guys. You've heard it. If anyone you know or your loved ones who are going through MS and fits the bill and want to try out, to try and screen for this trial, the link will be included.
Yes,
Yeah,
and,
you're
and
gonna.
tell your friends, tell them, share it widely. We have consented 67 people, which means we have about uh, 90 people that we can still consent. And so I anticipate another 16, 17 months that we'll still be recruiting. And so the key thing is you must have relapse remitting MS. You have to be willing to come to Iowa and come to Iowa at month 0, month 3, month 24, and be willing to be randomized. And again, I want to be clear. I anticipate all three groups will improve, and that we have levels of support for all three groups.
And you know what, Terry? The thing that I love about what you do is that you walk the walk. You don't just talk the talk. You've gone through it yourself. As you said, the disease itself is it's near and dear to you, that what you've gone through and sharing your story. And I thank you very much for sharing with us. Really showed your passion in battling against this disease, and knowing that even though we don't know the exact cause of this disease, there are things that we can do, there are modifications to our lifestyles that we can make in order to improve that disease progression.
Oh, absolutely. There's so much that we can do. And again, um, I- I'm very optimistic that a ketogenic diet incredibly helpful for people who have any kind of neurologic condition. And if you have relapse remitting MS, yes, there's this inflammatory component, but there's also this degenerative component that that the shrinking brain, shrinking spinal cord that is going on. Uh, so the drugs do a great job of stopping the inflammation. The drugs do not stop the neurodegeneration, that is the shrinking brain, the shrinking spinal cord, and it slows the time to being wheelchair dependent, but it doesn't stop it entirely.
Right. And speaking of ketogenic diet, I want to take this opportunity to thank our podcast sponsor, which is Ketone-IQ by H.V.M.N Nutrition. And I have to ask you, as we do sell exogenous ketones, is there a role of exogenous ketone in multiple sclerosis?
I think exogenous ketones can be very, very helpful. Absolutely. And I regularly use exogenous ketones myself. So, yes, I think that can be helpful. That is not part of this study design. Um, should have, in retrospect, perhaps that would have been useful, but that was not part of the study design.
Right. I would love to have any future collaborations with you, Terry. So if you have any interests or opportunities, let's have a chat.
Oh yeah, yeah, absolutely. We're writing grants all the time, so yes.
One of my colleague, her mom has MS, and I will definitely share your link with her as well. And she, after using Ketone IQ, anecdotally, her mom's cognition definitely improved significantly, and it was an acute effect that, it was very pronounced, that she now became, a strong supporter of Ketone IQ.
Yeah, I think additional ketones can certainly be very beneficial. There's plenty of evidence to suggest that glucose metabolism in the brain becomes compromised, and that contributes to why cognitive decline occurs with MS, with Alzheimer's, and other forms of dementia, and that um, ketone metabolism is not compromised, which is one of the reasons why uh, ketogenic diets can be helpful, why exogenous ketones can be helpful for improving mental clarity. And probably also, I think that's part of why in the other ketogenic studies, um, the ketogenic diet led to reduced anxiety, reduced depression.
Yeah, and I think Dr. Chris Palmer from Harvard, a psychiatrist, he talked a lot on using ketones in treating psychiatric disorders such as anxiety, schizophrenia, and depression. And just because ketones being able to really answer, to be the solution to that energy deficiency in the brain.
Correct, correct.
Yeah. And, we talked a lot about dietary change. We talked about treatment. Another thing we talk a lot on this show is the mental aspect of things, which I think, a lot of people should pay more attention to, especially when we talk about behavioral change. And you touched a little bit earlier on this because, behavioral change, since we are not robots, we're not programmed to just switch on or off. What advice do you have for people who are trying behavioral change methods and have their mindset, like what should they do around the mental aspect
You
of
know,
things?
I took care of veterans at the VA hospital, and because I had such great success, my hospital pulled me out of primary care and had me create my own clinic. We called it the Therapeutic Lifestyle Clinic, and we had so much demand that I kept redesigning that clinic so we could let everyone in as they wanted to come. And we'd have group classes. We would bring people in. I would do the initial intake as a group, then bring them back for monthly group visits. And then we started having skills classes. So they would come monthly for the group support class, and then they could do that for 6 months. And then for forever, they could come once a month to the skills classes. And we had health psychologists, we had physical therapists, occupational therapists, dietitians, chefs. And so I would have thought that perhaps it was the exercise classes that would be the most impactful, or the cooking classes that would be the most impactful. What was the most impactful was the understanding your hero's journey. What is your mission? What is your why? What my vets taught me is that you have to understand and grow your internal motivation to do this work, and to really understand what is it that you care so much about, that you would walk into a house that was beginning to be on fire, smoke's rolling out of the windows, maybe there's a flame shooting here or there, that you would go in to save that person or that work because it was so important to you. And then when we identify what you care so much about, now I can link that, and for many, it's their spouse, their children, their grandchildren. Like, okay, if you want to be there for your spouse or your child or your grandchild, now what's the next tiny little action you could take that would make it a little bit easier for you to eat a better diet, do a little exercise routine, or a little stress reducing program. And we start with one tiny little action that you can start with, so they could have some success. Because whenever you create a new habit, it's work. It's work. It's energy. And people with complex chronic diseases are fatigued. They're exhausted. This is a really big ask for them. And so for them to be motivated, if we can get into what is your why, that's very helpful. Another class that my vets taught me that they really, really loved, which was their hero's journey. And let me give you the context. There are hero stories across religions, cultures, across all the great societies. Societies facing some terrible threat, and they're losing terribly. The hero separates from the struggle, goes to work with a mentor, and they learn something really important. They come back to society, engage in the fight, and now the story is going to fluctuate a little differently. If in the Eastern societies the hero might lose, and die, but the society survives. In Western society, we know that against all odds, the hero's going to win, and he'll get the girl or the handsome guy, and everything will turn out fine. I think the Eastern stories are much more interesting because you don't really know how it's going to turn out. There's much more at risk. And the vets and I was like, if you want a really exciting hero story, it has to be a tough, big, terrible foe that you are fighting, and the chance of success is not guaranteed. And you might be like the Eastern Society guy, that maybe you're gonna die, you're gonna succumb, but your effort will inspire everyone around you. Your effort will inspire your grandchildren. Your effort will be worthy of a wonderful hero story. And that captured my veterans so thoroughly that now they were willing to do the work. They were willing to realize, yeah, I do have a terrible disease. I do, and maybe I'm not going to succeed, but my kids and my grandchildren are going to see me working at it every day anyway. And now they're willing to do the work. We have to have a story that I'll tell myself that makes me willing to do the work, even if I don't know if I'm going to succeed. Even if I know that I'm facing a terrible, terrible circumstance. And so this is all about the reframing of how I face my challenges, and how I face my willingness to struggle, and how I embrace that. Yeah, it might. Maybe I'm gonna die in the process. Maybe I'm still gonna be in my wheelchair, but my kids are gonna be impressed that every day I was willing to do my part. That
Yeah.
turns out to be the most important classes. And now when I run my lifestyle class at the VA or my clinic for my private patients, that's where I start. We have to get people willing to be inspired, to realize it's possible, to realize, yep, there's no guarantee. You got a terrible disease. Life's life's a bitch. It's not fair. Um, and you've got a great hero story that will inspire people for decades. Are you willing to play to your hero story? And once I get them bought into that, then we can begin to work on. So what's the next small little task that we can have you begin to work on?
That's that's really inspiring. So, in other words, really find the why, the mission of your life, and then hone into that and be an inspiration, not just for yourself, but for people that you love around you.
For everyone that is around you.
Yeah. And then, take small steps towards that change.
Little tiny steps. And you can decide that, and I used to think that everybody had to start with diet first. And I did that the first year. Then finally I realized, no, no, no. Some people need to start with stress reduction because they have to reduce their stress, reduce their cortisol, and then they can come back and say, you know what, I'm ready to start working on my diet now. And so we would eventually come around to talking to our vets like, okay, if you want to work on health behaviors, we'll send you to the health psychologist. If you want to work on exercise, we'll send you to the physical therapist. If you want to work on diet, we'll send you to the dietitian. Um, and if you want to be in part of the group classes, you're going to have to commit to that you're ready to do the diet. But you could work individually on diet very slowly, individually on stress reduction, or individually on exercise with one of those health professionals. But if you want to be part of the group classes, we would make people wait until they're ready to start working on their diet.
That's fair enough. And are you giving any presentations, any seminar in the foreseeable future, if people looking to, listen to you speak.
Yes, we have some really wonderful opportunities. We have because we have some sponsors, and maybe I should get you in charge with my team. Um, we are going to have a monthly virtual seminar to the public, and as a matter of fact, the next one I believe is January 17th, and it is once a month thereafter. If people want to learn how to sign up for that, you have to go to my website and sign up for the email, and there you will get you'll get notified for these monthly webinars that we'll be doing. I believe they're called our wellness seminar series. Although I have to admit, my team's in charge of that. I just give the talk, so I don't quite know how what they've called it.
Fair enough. You just show up and just share your knowledge.
Yes.
Yeah, no, happy to see any way we can help and collaborate. So
Connect you with my team, because I certainly believe in ketone salts. I think that would make a lot of sense.
yeah, and you've tried Ketone-IQ yourself. The first time we met, I made Terry take a shot of Ketone-IQ.
Yeah, it was good.
Yeah.
Well, yeah, it was good. Ketones are an acquired taste, but I love the mental clarity I have with being in ketosis.
Yeah, absolutely. So before we go off as well, if our listeners would love to find you on social media or any other platforms, could you please let our listeners know where can they find you?
So my Instagram is Dr. Terry Wahls. That's Dr. Terry TerryWahls. There you get to see what I'm eating, what I'm doing. You get a lot of inspiring messages. My website is Terry Wahls, Terry, Wahls, WAHLS.com. My Facebook is Terry Wahls. And Again, when you go to my website, be sure to sign up for the newsletter because I have a weekly email that talks about interesting research that caught my eye. And then you would get to hear about our wellness seminars that we're running.
There you have it, like one place that has everything. Sign up for the newsletter. Um, Once again, Terry, thank you so much for coming onto our platform, and thank you so much for sharing your inspiring story as well as your amazing work against MS. I really appreciate it. Thank you.
Thank you.